The local doctor's in for everyday solutions. Now, Dr. Zunin, depression is very common, unfortunately. So what can people do if they've already tried medicine and therapy, but those do not offer a cure?
Great question, Cynthia. Good to see you again.
Yes.
You know, depression is so common, and we're in the middle of this tense police investigation this morning. You never know. Sometimes depression is behind these kinds of situations.
And so what can people do?
So there's a form of treatment that involves gentle magnetic pulses through the head to the brain if medications and therapy don't work. Those are always the first line, but there's it's called TMS, and many people are getting a lot of success. It's FDA approved, it's covered by insurance.
Wow, so tell us, how does this work? I know you said something about magnetic pulses.
It's a machine. I think we're seeing some pictures here. It's a machine that generates gentle magnetic pulses with a handheld device that's placed onto the head, and it involves no medication. It's pain-free. It's easy to do. It's done in the comfort of the doctor's office, and you can continue your regular daily schedule.
So how does this work to help with depression, these magnetic pulses? Explain to us how this is easing those concerns that people may have.
There's a part of the brain called the limbic system, which is kind of here. And what it does is it will change the frequency and the wavelength of certain brain impulses that will affect these things like depression. But it's also FDA approved for smoking cessation, for certain types of migraine headaches, for obsessive compulsive disorder. It's not covered by insurance yet. The depression is covered by insurance.
I see. So for those who may want to seek this alternative, what should they do? Should they ask their doctor, like if medicines don't work, what is the next step for people?
Certainly, asking a physician. There's several facilities that do it on Oahu. Our own facility has a kind of a unique aspect of this TMS called MERT, which is customized, and it involves less magnetic energy and will treat autism, concussion, PTSD, a lot of other things. But the main thing to remember is, for now, the TMS is covered by insurance for depression, resistant depression.
So what is resistant depression? For those who maybe they feel down, how do you know you have depression versus just feeling, the blues?
Well, first of all, it's usually there for a while, for a couple of months or more. We have difficulty sleeping, not interested in eating, our confidence is down, and sometimes there's positive symptoms of depression, like this investigation right now, this tense investigation. But sometimes people just can't get out of bed or can't think clearly. But resistant depression is when you've already tried one or two medications and have had some therapy, and it still doesn't go away.
Okay, so that's when you could rely then on this new
magnetic type of, and it's actually not new. The TMS has been around for a long time, but there's so many people with depression. We're just seeing its use more and more.
Mahalo. Thank you, Dr. Z. Really
Thank
appreciate you
Cynthia.
being here. And of course, we will have all of this on our website, KITV.com.